Unexpected causes making constipation worse than you might think. If you are experiencing constipation, meaning less than 3 bowel movements a week, hard or lumpy stool, or you have to strain a lot to pass stool. Constipation is not only an uncomfortable personal health issue but also has a significant impact on quality of life and the healthcare system. Every year, an estimated 2.5 million people in the United States seek help from a doctor for constipation, highlighting the prevalence of this condition. Furthermore, according to some reports, constipation causes over $700 million in healthcare costs each year, including treatment costs and lost work time. Beyond the financial burden, constipation causes pain, discomfort, and negatively affects the mood and daily activities of the person suffering from it. This condition can also be a sign of more serious health issues, such as digestive tract problems or nutritional imbalances, requiring resolution to improve overall health. Here are some of the countless reasons that might lead to constipation. Sitting too much. In exploring the causes of constipation, you may be surprised by some of the answers. The modern sedentary lifestyle not only harms your waistline but sitting for long periods can kink your colon, preventing stool from moving through and leading to constipation. Take the time to stand up and move around frequently. Walking and deep squats are particularly effective activities to stimulate bowel movements. If constipation is a long-term issue and you don't want to squat over your toilet, many have found comfort in using a squatty potty, a device that raises your legs to a more natural position for defecation. A dairy-heavy diet, consuming a lot of dairy products, especially cheese, is a major cause of constipation, not because they inherently cause constipation but because they replace other fiber-rich foods like whole grains, fruits, and vegetables. Maintaining a high-fiber diet can reduce the risk of heart disease, stroke, type 2 diabetes, and some types of cancer, most commonly seen in children. Depression and low-carb diets. The feeling of depression not only leads to weight gain and constipation but also due to the side effects of antidepressant medications. Non-drug methods such as cognitive behavioral therapy, exercise, and meditation can be as effective as medication. Additionally, low-carb diets are a culprit for constipation complaints after starting them. Focusing on meat, eggs, and fats leaves little room for plant fiber. Indeed, many deliberately avoid fiber-rich foods like whole grains, fruits, and vegetables because they contain carbs. However, not all carbs are bad. Focus on eliminating highly processed carbs or foods with a high glycemic index like sweets and white bread. To keep your colon healthy and prevent constipation, you should consume at least 5 servings of fruits and vegetables a day. Fiber, sometimes the culprit, although fiber is often seen as a solution for constipation, consuming too much can also cause the condition. This is particularly true when people use fiber from supplements like pills or powders rather than natural foods. Studies show that while fiber supplements may seem a healthy way to increase fiber intake, most do not provide the health benefits associated with a high-fiber diet from natural foods. Chocolate and laxatives. Chocolate can cause constipation, although its effect varies from person to person. The only way to be sure is to eliminate chocolate from your diet for a time and observe any improvements. On the other hand, using laxatives might seem like the best solution for constipation, but it can worsen the problem. Laxatives should only be used on a short-term basis, for a week at most. Long-term use can make your bowels dependent, leading to a vicious cycle of constipation and diarrhea. Prescription medications and multivitamins. Many prescription medications list constipation as a side effect, including antidepressants, anti-anxiety drugs, heartburn medications, and blood pressure pills. There might be other medication options that do not have this side effect, but you need to discuss this specifically with your doctor. For example, some heartburn medications contain calcium, which can cause constipation, so you might opt for those based on magnesium. Changes to your medication should always be made under the supervision of a doctor. Vitamins that contain high levels of calcium and iron can be extremely constipating, and yet many people do not realize this and take one every day. Only those diagnosed with a medical condition requiring iron supplementation, such as iron deficiency anemia, should use supplemental iron, and then only if recommended by their doctor. Painkillers. from prescription opioids like hydrocodone and OxyContin to over-the-counter medications like acetaminophen and ibuprofen, can also cause constipation. These medications bind to the same receptors in the stomach, inhibiting the entire digestive system as well as your pain. While taking painkillers, you should make every effort to resolve the underlying cause of the pain or find other pain treatment.